Okay, good afternoon, everyone from Bangkok, and welcome to this socialprotection.org webinar on strengthening capacity to design and implement risk-informed and shock-responsive social protection systems in ASEAN member states. My name is Ellen Kramer, and I work with the World Food Programme Regional Bureau for Asia and the Pacific, based in Bangkok, as a regional program advisor. And I will be your moderator for today's discussion. First, I'll say a few words to set the scene for the discussion, and then introduce the speakers and hand over to them for their presentations. After the presentations, we will have about half an hour for questions from the audience, and I encourage you to send questions throughout the webinar through the chat box that you have on your screen. Okay, so welcome again to today's webinar, and this has been a part of a series on shock-responsive social protection through socialprotection.org, which is showing the importance and relevance of this topic. Today's webinar is hosted by FAO, OPM, WFP, and ECHO, and it is on strengthening capacity to design and implement risk-informed and shock-responsive social protection systems in ASEAN member states. This initiative is part of the joint UN project, the joint UN team members being FAO, ILO, UNICEF, UNISDR, and WFP, with ASEAN, funded by ECHO. And the project aims to improve the availability of policy and operational options for ASEAN member states to strengthen the shock responsiveness of government-led social protection systems. The project included 5 research pieces, a regional synthesis study on shock responsive social protection, which was conducted by OPM, and 4 in-depth country studies to develop roadmaps and policy options for social protection systems to be flexible to respond to disasters. The in-depth studies were in Cambodia and Philippines, led by FAO, in Myanmar, led by UNICEF, and in Vietnam, led by ILO, and all of these studies were conducted by the Food Economy Group. And the findings from all of these studies together were used to develop the ASEAN-specific guidelines on disaster-responsive social protection. The country studies are in the process of being validated and hopefully can be part of a future webinar series. So this project, it complements and draws upon previous shock responsive social protection studies. And one aspect of this project that is unique is the involvement of the ASEAN Committee on Disaster Management, the ACDM. And ACDM had expressed a strong recognition of the need to engage other relevant ASEAN sectoral bodies, specifically the social welfare development, the health development and rights of women and children bodies in their request for this research and to develop the guidelines. And this has been a priority of the ASEAN Agreement on Disaster Management and Emergency Response work program for 2016 to 2020. And the work program focuses on the development of social protection options for more effective disaster response. So building on this, the speakers today will focus on the results of the ASEAN regional study and on the ASEAN guidelines, drawing on the research questions: what factors enable social protection systems and programs in ASEAN countries to be responsive to shocks and to deliver an effective response, and how the ASEAN guidelines will support the ASEAN member states to respond to disasters. So with that, I'd like to introduce to you our panelists today. We have Maham Farhat, who is with the OPM Social Policy. And Maham was the project manager and case study lead for the regional study. She is a consultant in OPM's poverty and social protection team and has extensive experience in designing and implementing mixed methods research. And she is currently based in OPM's Oxford office. Next slide, please. Okay, next we have Rodolfo Beazley, and he was a team leader for the regional study. He is a senior consultant in poverty and social protection at Oxford Policy Management. He is an economist with more than 10 years of experience and specialized in the design, implementation, monitoring, and evaluation of social protection and labor policies. He's done a lot of work on the shock responsive social protection, and I'm sure you've seen him in other webinars on this topic. Finally, we have Hang Pham, and Hang has been taking the lead in coordinating the whole project at the regional level. So many thanks to Hang for her coordination efforts. Hang is working as the senior resilience officer in the FAO regional office for Asia and the Pacific, where she's been since 2016. And Hang has a plethora of other experience working in humanitarian and development settings. So with that, I would like to begin with the, okay, well, here's me. I'm Ellen Kramer again, and I'm with the World Food Program based in the Regional Bureau in Bangkok. So finally, we have many participants who are joining us from around the world today, and we thank you for participating and making this webinar as interactive as possible. So please do send in your questions for the speakers using the chat bar, and at the end I will ask the panelists to respond to the questions and answers. So as I said, if you would like to submit a question, please do so at any time during the webinar in the panel that you have on your screen. For questions that we don't manage to get to during the webinar, we will circulate a note afterwards with responses from the presenters. And this presentation will be recorded, so you can go back to the presentation at any time at your leisure later. And you can also follow the discussion on Twitter and Facebook, and join the online community on socialprotection.org to see this, this presentation again, as well as any of the other webinars that have been handled through socialprotection.org. Okay, so next I would like to introduce the first presentation, and this will be given by Rodolfo and Maham, and they will present the regional synthesis study, including shock responsive social protection experiences in ASEAN, as well as highlight the enabling and constraining factors for shock responsive social protection in the ASEAN member states. The speakers will both provide key recommendations from the study. So I will now hand over to Maham to start the presentation. Thank you. Sorry, Maham, you're on mute. If you can unmute your screen, please.
Okay, right. Okay, can you hear me now? Hello? Hi.
We can hear you. Go ahead.
Okay, right. Sorry. Thanks, Ellen. And good morning and good afternoon, everyone. As Ellen said, I will be presenting OPM's work together with Rodolfo, which focuses on the work that we did creating the regional synthesis report for this joint UN project. I will give a brief background to the regional report itself and how we conducted the study behind it, and then give a brief overview of the experiences in the ASEAN region around shock responsive social protection. And then Rodolfo will take over and explain a little bit the different enabling and constraining factors around shock responsive social protection within ASEAN, followed by some recommendations for member states. So if you could please go to the third slide, which says regional study overview. The next one. So this is, our work was based on some light case studies in Thailand and Laos PDR, a regional literature review and secondary data sources. We of course also took into account the in-depth work that Ellen mentioned was done in other countries such as Myanmar, Vietnam, Cambodia, and the Philippines. Our work largely focused on social assistance within the broader spectrum of social protection programs, and was focused very much on natural disasters in comparison to man-made disasters. And our work basically provides a framework for assessing shock responsive social protection in the ASEAN region and the broader policy recommendations around it. We drew primarily on qualitative research methods and on an extensive documentation review. Next slide, please. So, very briefly, for those not familiar with the conceptual framework around this, we thought of social protection systems and we broke them down into different components. And these included, for instance, coordination and institutional capacity. So these are the icons you see in blue. We thought about delivery systems, which included targeting, so the way in which recipients of cash transfers or in-kind benefits or other benefits are selected. So that would include targeting mechanisms, and then the delivery mechanisms as well. So what types of payment methods are being used, whether it's mobile money, whether it's manual, whether it's bank transfers or credit cards. We also took a look at the different information systems that are being used in social protection programs. And so this includes social registries, MIS systems, and then another very important aspect, of course, of social protection systems is financing. And so that includes both external and internal financing. So that is government and non-government funding. Then we analyze these different aspects of social protection system, and we think about how can social protection programs respond to shocks. And so the way we categorize it is to say, well, programs can expand vertically. So when, for instance, if a certain country experiences a natural disaster, you could increase the benefit value or duration of an existing benefit. So if it's a cash transfer, for example, you increase the amount of the cash transfer, or you could do horizontal expansion. And so you just increase the caseload of beneficiaries in an existing program. Another option is piggybacking, which is using a social protection program's administrative framework, but running a shock response program separately. So that is one option. Another option is alignment, in which you basically design an intervention with elements resembling other elements that already exist, but you don't integrate the two programs. So, for example, governments may align their systems with those of humanitarian agencies or vice versa. And the last type of response is design tweaks, where one makes small adjustments to the design of a core program that already exists so that it can respond to shocks. Next slide. So as Ellen said, we conducted, the next slide, please. We conducted an extensive literature review to see if there were existing examples of social protection programs in the region responding to shocks. And we found that perhaps, it wasn't a surprise, but we found that there were very few experiences of shock responsive social protection in action within the region. And these examples primarily came from vertical expansions and design tweaks. So vertical expansions, one of the most popular cases and most widely referenced cases was the Philippines, where the Pantawid CCT gave top-ups to its beneficiaries in response to Typhoon Haiyan in 2013. Another example was Thailand, where unemployment insurance was extended from 6 to 8 months for formal sector employees in response to the 2011 mega flood. In terms of design tweaks, where you make small changes to an existing program in response to a shock, there were examples again from the Philippines, where the Pantawid CCT suspended conditionalities for a limited amount of time because a state of calamity was declared. Another example was Indonesia, where the National Program for Community Empowerment developed a set of operational procedures to expedite and support disaster recovery. And then again in Thailand, for example, the Social Security Act established a protocol to reduce the number of employee and employer contributions and to extend the duration of unemployment benefits during emergencies. So this, for example, was a classic case of a contributory social protection program that was changed slightly to respond to shocks. We couldn't find any examples, at least any published or known examples, of experiences where countries had expanded social protection programs horizontally or had piggybacked onto an existing program. Next slide. And well, I mean, there are quite few experiences in the ASEAN region of social protection programs responding to shocks, and this is not new to just ASEAN. It is a fairly new area of work globally, and as in other regions, social protection has not necessarily been designed to respond to covariate shocks or external shocks, as we say. There's also a fairly long tradition of employment-based social protection. So, for example, contributory pension schemes. Although we know that increasingly self-employment and informal economy workers are growing, and they make up the majority in many of the middle-income and low-middle-income countries in the region. Another reason why perhaps we haven't seen as many experiences in the region is that social assistance systems, such as, say, unconditional cash transfers, are still very much in a nascent stage and are still developing. And as you can see from the next slide, please, we also know that in ASEAN, the percentage of spending that is done on social assistance as a percentage of GDP is very small compared to other regions. So as you can see, it's around 0.63%. Compared to, say, in the Latin America and Caribbean region, where it is around 1.54%. So this was a brief overview of what we found through our country visits and through the literature review. I will now hand over to my colleague Rodolfo, who will go through the next part of the presentation.
Okay. Thanks, Maham, and thanks to the organizers. Next slide, please. Okay, so I'm going to present about the enabling and constraining factors for shock response social protection in ASEAN, and then I'm going to present quickly some broad recommendations. Next slide, please. Okay, so in relation to, I'm going to go through each of the processes and systems from the framework that Maham presented before. So starting with coordination. So most countries in the region have DRM frameworks, laws, policies, plans in place, and this is of course an enabling factor. And they have also adopted international frameworks. There are only a few countries in the region in which social protection has a DRM mandate, like Philippines, Thailand, Vietnam. In those cases, of course, this is a key starting point for shock response social protection. But in most countries, this is not the case yet. Despite having DRM frameworks, plans, and laws. There is limited implementation and enforcement of DRM legislation, and there are challenges with mainstreaming DRM. We describe this in our report, and you can find the details there. And there is overall limited coordination between DRM and social protection. This is not a surprise because these are two sectors that have been developed for different purposes, and they haven't interacted a lot. And this is similar in other regions of the world, so it's not a surprise. No? Next, please. So in relation to delivery, there are high levels of mobile network coverage and access to formal banking, and this provides opportunities for electronic transfers. There are a number of flagship programs in ASEAN countries delivering cash electronically. However, there are others that still transfer cash manually. This should not be seen as a constraint necessarily, because I mean we have seen in other regions that programs with manual payments have managed to scale up in response to emergencies, so it's not a constraint. In some countries in the region, there is reluctance to give cash to beneficiaries, like for example in Laos. Overall, there is a limited flexibility in these delivery systems and in these payment systems. They haven't been designed for scaling up, and they haven't been adapted. And the same happens with targeting mechanisms. These mechanisms have been designed for identifying the poorest of the poor or providing support along the life cycle, but not necessarily for identifying those who are affected by sudden crises. No? Next slide, please. In relation to information systems, there is an ongoing development in the region in many countries of social registries or beneficiary registries. We describe this in the report, and we present information for most countries. However, there's still limited integration of social protection data, limited interoperability of information systems, low coverage of social registries, and there are also data quality challenges. We study data quality from different perspectives: accessibility, relevance, how up to date data is, and so on. Beneficiary registries are not typically risk informed. They are built for other purposes, so they don't necessarily collect data that can allow measuring vulnerability and exposure to risks and so on. Next, please. In relation to financing, in line with the fact that most countries have DRM plans and laws, they do have budget provisions for DRM. However, these are not always adequate. And there are no predefined commitments to channel resources through social protection in order to respond to emergencies. This is not a surprise, because the social protection sector has not been, in most cases, adapted to respond to shocks yet, and it's the same happens in other regions of the world. And there is a lack of a layered disaster risk financing strategy in many countries. This is a strategy that combines different financing instruments. Like for example, Philippines is the only country with a CADDO, that is a contingent credit line by the World Bank. So we have seen few countries that combine this type of contingent credits with market-based insurances and so on. Next slide, please. Okay, now I'm gonna present some broad policy recommendations based on this research, but also on the research that we and others have conducted in other regions, so to learn from other regions as well. These are broad policy recommendations because, of course, ASEAN is a diverse region, and in the end, recommendations need to be context specific and will depend on the maturity of the social protection and the DRM sector, the exposure to risks, and so on. Next slide, please. Okay, to begin with, some overarching recommendations that are key ones. To begin with, keep investing in the development of social protection systems, and in particular social assistance for the regular mandates. As Maham presented before, the investment in social assistance is not as high as in other regions, and when we look at and we show this in the report, when we look at coverage and so on, there is still some development to be made, and therefore the main recommendation is keep investing in social assistance for the regular mandates. Then another recommendation is to conduct feasibility and diagnostic assessments to assess whether social protection should play a role in shock response. It doesn't have to be assumed that these systems need to be used. This depends again on the context and also on the capacity of the DRM sector to respond. Then nascent social protection systems and in particular social assistance systems, like many in the region, should not be overburdened. There is a risk at asking systems that are in a process of development to be flexible and scale up. No? So I mean, it's important to keep this in mind, and also it is essential to shock-proof social protection systems so that they can continue delivering the regular transfers during crises. No? Okay, next slide, please. Okay, now in relation to coordination and capacity, I'm not going to present every recommendation for the sake of time, but you can find them in the report. If after conducting the diagnostic and feasibility assessment, you want to develop a shock response social protection system, okay, so the first or the starting point would be to develop a strategy that is part of the DRM framework. No, social protection, shock response social protection needs to be one component of a more holistic approach to the issue, and it's important to embed DRM in social protection mandate, strategies, activities, protocols, and so on. Next slide, please. In relation to delivery systems, in particular, if the strategy envisages horizontal expansions or piggybacking, but any strategy that entails scale up, no, increasing the caseload, then the system needs to be adapted, and there is a lot of investment that has to be done beforehand in order to be in a position to expand. No, and this includes developing protocols, developing standby agreements with payment service providers in order to scale up. Could involve adapting the IT platform so that it is feasible to increase the caseload and so on. No, so there is an important investment to be done ex ante. Next slide, please. In relation to information systems, as I said before, in many countries they are still developing this type of systems, and this is an opportunity to make them more risk informed and to gather data that can allow measuring vulnerability and exposure to shocks. Could also be an opportunity to gather data that is operationally relevant for planning and responding to shocks, like for example the geographical location of households or bank account details and so on. In other regions, we've seen the capacity of social protection, in particular at local level, being used to collect data in the aftermath of a shock, or to identify households affected by the shock. So this is something that for flagship programs with strong capacity at local level could be considered. Next slide, please. Next slide. Okay. Now financing. Okay, so the first point would be or the first recommendation is to develop scenarios based on the risk profile of the country and to anticipate funding needs, and then to consider developing protocols and commitments for channeling support through social protection. We've seen that the lack of these protocols and commitments ex ante is one of the main barriers for a timely response through social protection. And then, as I mentioned before, consider layering different disaster risk financing strategies and combining different types of instruments. Next, please. Okay, and finally, how to respond. Well, I'm not gonna say how each country should respond, but some things to consider. Vertical expansions, they are administratively easier and quicker because in the end it's just about giving a top up to existing beneficiaries. However, global evidence shows that preparedness is essential for a timely response, and preparedness in terms of developing protocols, of adapting the capacity, and also in terms of the financial commitments, as I mentioned before. Without this level of preparedness, even vertical expansions, what in theory easier, can get delayed and tend to get delayed. Of course, at vertical expansions, they only reach beneficiaries, and so they will need to be complemented with other types of responses to reach those who have been affected and are not receiving benefits from social protection. But in some cases, for example, in Fiji, they have combined the expansion of different programs, the vertical expansion. So this is a way of increasing the coverage of the response. In terms of horizontal expansion, there are very few experiences globally. We explain why in the report, but as I mentioned before, a key issue here is that there needs to be a lot of investment for a program to be able to scale up and to be flexible enough. No? Finally, in terms of piggybacking, there are a number of experiences globally, and what is attractive about this strategy is that you pick the system, the process that is strong enough to be used in such context. So, and this could be the IT platform and the database, or could be the payment delivery mechanism, or could be the human resources of social protection. No? Next slide. I think that's all. Okay, well, thank you very much. Now over to Hang, I think, or back to Ellen.
Hi.
Yeah, back to Ellen.
Okay, thank you,
Ellen.
Rodolfo and Maham, for sharing the findings from the study with us. It's very interesting, and we're looking forward to the discussion and the questions and answers later in the webinar. So please, colleagues who are listening in, send your questions, and we'll have more discussion on the study at the end of the webinar. So I'd like to hand over now to Hang, who will present the ASEAN guidelines on disaster responsive social protection, which aim to enhance the capacity of ASEAN member states to design and implement social protection programs that can also deliver disaster response and help vulnerable households build resilience to shocks and stresses. So thank you, Hang, over to you.
Thank you, Ellen. If you don't mind, I would like to switch off my camera to ensure that the line connection is stable. Good afternoon, everybody. With these presentations, what I would like to do is to give a little bit of the context behind the project approach that we have taken to introduce the shock responsive social protections in the ASEAN regions. I will also walk you through a little bit of the findings of the country in-depth studies and the emerging options and roadmap that we are working to support the ASEAN member states with Cambodia and Vietnam as examples. And as Ellen mentioned, I will also walk you through a little bit on what kind of the regional guideline on shock responsive social protection that we have support the ASEAN developed. What are the reflection and learning that we have got through the process? And then how do we see moving forward? Next slide, please. The next one. Next. Okay. Hello. Next slide, please. Okay. So just very quickly on the ASEAN context, for those of you who are not familiar with the regions, it's a very fast-growing regions. With GDP more than double during 2000 and 2017. And that economic growth has also been very instrumental in reducing the extreme poverty from 47% in 1999 to 14% in 2015. But the region has been home to 36 million who are living under extreme poverty, and disasters is one of the reasons for this kind of like poverty situations. The ASEAN regions suffer from the average annual economic loss of 4.4 billion due to disasters every year. Also, climate change is going to increase the intensity and frequencies of the hazard and vulnerabilities. And another characteristic of the region is the widening disparities and inequalities, which will also contribute to vulnerability to disasters and climate change. Next slide, please. Just very quickly, as I'm sure many of you are familiar with these global climate risks. So in 2017, ASEAN member states have Thailand and Vietnam among the top 10 most climate vulnerable countries, but in the longer period of 10 years, countries like Myanmar, Vietnam, Philippines also in the top 10 vulnerable countries. Next slide, please. So the ASEAN member state has more than 50 years of regional cooperations with an agreed charter, with a vision which is like forging ahead together for 2025. And this vision is going to be achieved through the three pillars of cooperations: political and security, economic, and social control. So disaster, climate change, social protections are all under the social control pillar of the ASEAN cooperations. And ASEAN cooperation is also implemented through a lot of like instruments, including legally binding, like the ASEAN disaster this agreement for disaster management and emergency response with the 5-year work plan implemented by all the ASEAN member states, or the ASEAN declarations on institutionalization resilience of the ASEAN and communities, or the ASEAN declarations and regional action plans on social protections. So within these kind of structures, corporations within the ASEAN, next slide please, what we have come up with, the approach with the project is two interlinked processes, as Ellen introduced you. At the country level, what we see is from country to the regions, where we undertook the in-depth studies of social protection systems, of disaster risk management system. But very important is a process of engaging different government sectors and stakeholders in coming up with what are the options for the ASEAN member states to move forward responsive social protections, and for that options, what kind of roadmap that can be developed for implementations. And at the regional level, as you have heard from OPM colleagues, we undertook this regional synthesis studies to understand the ASEAN member state readiness for responsive social protections. That together with also country in-depth studies form the basis for us to support the ASEAN member state in developing guidelines for responsive social protections. And again, it's a very like participatory consultation process among different sectors within the ASEAN to endorse the guideline. Or the underlying principle for us to undertake both processes is are the following: multi-sectoral and multi-stakeholder engagement. including through the cross-sectoral coordination mechanism within the ASEAN. Make sure that the process is participatory, consultative, and by doing that, building the capacities of the agencies involved. We also involve strong engagement and learning from the local level experiences while facilitating this intersectoral coordination, for example, between disaster risk management and social welfare, and promoting future collaborations, and including also ensuring the joint UN approach. Also, we are working with the Asian Development Bank in this initiative, ensuring that we are harmonizing and developing coherent technical support to the member states. Next slide, please. Just quickly on, next slide, please. To walk you through a few country process, I think is quite standard for all the countries, where you can see that we have gone through a series of bilateral consultation, a series of workshops, moving from analysis to identifying the possible, social protection programs with potential for scaling up, doing further consultation with the stakeholders to identify to discuss the options, and then developing the roadmap and validate the roadmap with the expectation that they would also build the strong political commitment for implementations. Next slide, please. So here's the example of what we have learned from the analysis of current social assistance programs in Cambodia. And a lot of these actually confirm what Maham and Rodolfo presented to you as the overall kind of situation in the ASEAN. So what we found is that the health equity program in health equity fund in Cambodia, it's the largest social protection program with significant improvement in coverage and has very good potentials to include the shock responsiveness elements. But at the same time, despite the progress made, the current social and health protections leave many vulnerable populations behind. Cash transfer social programs in Cambodia are at a very early stage, but at the same time, there is a number of the schemes that are being developed at various stages that has a potential for cash transfer. And but none of the existing kind of cash transfer social protection programs have this kind of emergency response design in their current design. But at the same time, the government, together with development partners, have developed what they call as the ID pool, as a core identification systems that is used by both development and humanitarian actors in the countries for emergency response and for poverty reductions. There is, similar to quite a number of ASEAN member states, the government of Cambodia has a very ambitious plan to increase social protection coverage and integrate support into what they call as a family package approach, starting with core transfer program, for example, supporting pregnant women and children, people with disabilities and others. So for Cambodia, while currently the overall social protection coverage is low, some programs are being tested, like the mother and child cash transfer led by UNICEF in the countries. And then those have potential to include the shock responsiveness and flexible design features. Next slide, please. Similar to the disaster risk management system, I think a lot of the findings that Maham and Rodolfo mentions about the availability of legislative framework, the policy framework for disaster risk management, but that yet have a strong link with social protection, social assistance, I think it's also applied for Cambodia. But in the country in-depth work, what we did is we look a little bit more in-depth into the existing early warning system to see how the system can be strengthened to trigger shock responsive social protections. So in Cambodia, and I think it's quite similar to a number of other ASEAN member states, is that the current early warning system does not include or does not cover risks and vulnerability analysis yet. It purely depends on weather forecast and climate informations. So early warning is quite typically available for sudden onset disasters like flood and typhoon, but it doesn't exist for drought. Although efforts through different kind of projects, programs are being made to collect data on drought indicators to inform a better early warning systems and trigger early actions on drought. When we look at an early warning system, there is a time lag between early warning and actions that needs to be filled through further decentralizations of the decision-making process and authority to make sure that the more rapid response can be undertaken. And very typically, it's social assistance or social care or support are usually provided after disaster event rather than like early, so that it has the better kind of like vulnerability and risk reductions impacts. But then there are the opportunities are there to define the early warning system triggers and thresholds so that they can inform the social protections and provide the social protections with the basis to respond better to hazard and disasters. And there are also opportunities to link these indicator systems and early warning with the existing ID pool system in Cambodia. And there was quite some consensus during the process in Cambodia, learning from the experience of the El Nino drought that hit the countries very hard during 2015, 2016, that actually early actions by scaling up some existing programs, including social protections, will have much better impacts and cost benefits. Next slide, please. Through the process, I think the two existing social assistance, social protection programs have been recommended to look further into, the possibility of scale them up to be shock responsive, which are the Health Equity Fund and the Mother and Child Cash Transfer. And these, as I mentioned earlier, have been assessed as having potential to be scaling up. Next slide, please. So based on this kind of all of the analysis of the systems, the option discussed in the consultation process, the roadmap has been developed for Cambodia that includes short-term actions during 2018-2020, the medium term for the next 3 years, and long-term beyond 5 years. The idea is in the short term, it's to focus on developing the scalability framework, continue with public commitment, policy engagement to scale up the Health Equity Fund and Mother and Child Cash Transfer, to build skeleton system focused on household capacity to absorb the effects of hazard, while accessing the capacity, building the institutional linkages to move towards with medium-term actions that will face the shock responsive social protection more widely, including other livelihood and employment programs, and strengthen the system to resist, absorb, adapt to, and recover from the effects of hazard. And again, like transition to longer term actions beyond 2030 that continue to strengthen the systems and moving towards integrated systems to establish shock responsive social protections. Next slide, please. Okay, now Vietnam has come up with quite different kind of like a roadmap, although the process of assessment and consultation is the same because the context is a bit different. There is a reform underway in both social assistance and disaster risk management system in Vietnam, including a very substantial series of review of the existing social assistance, social protections programs in the countries, and the development of the new master plan for social assistance, and a plan to also develop a law on social assistance. So within that context, the process in Vietnam was a bit more rapid because we needed to respond faster to these kind of policy demands from the government, and the proposal for Vietnam as a roadmap linked very closely with the reform process in the countries that included recommendations like immediately we need to make sure that there will be high-level political commitments in the policy and legislative framework, like the upcoming law, like the implementations plan of the master plan for social assistance, to create the mandate for the operational reform towards shock responsive social protections. So recommendations for Vietnam, recommended action for Vietnam included like incorporate the emergency scale up in the regular social assistance policy and legislations to reorient the focus from ex post to ex ante in the certain social assistance program that already has the mandate for disaster management, disaster risk management, to consolidate and refocus the emergency of social assistance, which is quite significant with a number of proven procedures in Vietnam, to build the case and consider options to extend social care during disasters, to reform the operational systems and processes, including to be disaster-proof, so that the system can ensure the provision of services during disasters. And again, strengthening institutional capacity and coordinations, as well as developing the financing strategies for these reform options. Next slide, please. Next slide, please. So, next slide, please. Quickly on the ASEAN guideline, as I mentioned, we draw on the regional synthesis study, we draw on the country work, and bring in these partnerships of the 3 different sectors, as Ellen mentioned: disaster risk management, social welfare and development, as well as health and human development, through these intersectoral kind of coordinations within the ASEAN for the guideline. So you will see the guideline that we will upload very soon in the online, that it provides a rationale why shock responsive social protections in the ASEAN context. What is the framework, the kind of conceptual framework that we are talking about? What are the principles that are relevant for the ASEAN context and the approaches, as well as the 5 building blocks for shock responsive social protection? So in addition to all of these conceptual framework and the explanations of the needs and how, we also added in the guideline an annex focusing on the how-to, including the entry point with the illustrations of the process, the questions to consider, the examples, the tips, including do and don't, and kind of like also reference to further tools and guidelines that member states can refer to in understanding the guideline and taking them forward for implementation. So what we have learned, which is a very nice surprise, is that it actually attracted a lot of attentions and interest by the member states. And why we were aiming at the endorsements of the guideline at the senior official level, which is at the Director General level, there was a request, particularly from the social welfare sector, to raise it up to the ministerial approval, because they believe that this creates a stronger legislative framework for the ASEAN to move more progressively towards this innovative approach of looking at building resilience to disasters. Next slide, please. So these are the feedback that we got from the ASEAN member states during the process of developing the guideline that will also give you like a better understanding of the regional context, but also the interest of the different government agencies. Very clearly, since this topic involves many sectors and stakeholders, so member state will say, be very clear about the audience who will actually implement the guideline, and then make it very explicit so that the implementers will know what exactly to do. But then at the same time, they ask, this is a very important topic, but we have to make sure that we balance between the strategic pitching, why shock responsive social protection in the ASEAN context? What are the benefits over the conventional social assistance or social protection that they already have, or the conventional disaster management system, which ASEAN is quite like spearheading among other regions in terms of regional collaborations. What are the challenges? And during the guideline development, what we found as a challenge is actually how to make the guideline responding best to the different needs of different sectors involved, but as well as the very varied level of understanding of the issues. And then also the need to balance between keeping this at the strategic high-level guideline or a very practical, detailed how-to implementation guideline. And there was a strong request for as many as possible of the practical example from the region, but as well as from other regions. And there was also the request, like, to take the guideline forward for implementations. They would like to have specific guidance for actions by different sectors. And as a regional guideline, further look, even if we develop it with a very strong understanding of the ASEAN member state context, still there is a request to localize the guideline in the different national contexts to ensure the implementations. Next slide, please. So I think this is the last slide that I have. Next slide, please. Next one. Okay. In moving forward, we believe that it's very important to maintain the same kind of two interlinked track, country level actions and regional level kind of collaborations framework to enable action both at the regional level and at the country level. So at the country level, we are now looking at validating the roadmap, really ensuring the ownership of the roadmap by the different government agencies for implementations. And one of the big lessons learned that we got, particularly out from the Philippines, is that the more we can align this kind of like roadmap and options for responsive social protections with the national social protection framework, then the more political buy-in and the opportunities to get government allocated resources and for implementations will be there. And very, very important that bridging between the momentum that had been created with the study, with the roadmap to move towards implementations while continuing engaging the political commitment from the member states. And at the regional level, of course, we need to really maintain this as an important agenda in the ASEAN context. And I think the ASEAN 2025 visions and all this blueprint of the three cooperation pillars of political sensitivity, economic, and social conscious will provide great opportunities to make it as an maintain an important agenda. But again, very important is to continue strengthening the evidence of benefits of shock responsive social protections and why it's crucial for ASEAN to move forward. The request for capacity building is really great. And there is a demand to really look at available global tools, training, material, and others, adapt to the regional context and provide that capacity building. And again, the underlying principles for us to move forward, it's continue coherent UN advocacy, technical approaches, and capacity building, and really drawing on the existing ASEAN governance cooperation framework and programs to advance the agenda. So I think I stop here. Thank you.
Great. Thank you very much, Hang, for your presentation and informing us on the process for the roadmaps and the policy development, as well as where you're moving with the ASEAN guidelines and the frameworks. So thank you for those of you as well who are sending in questions. And we'd like to jump right into the question and answer session. We have about 20 minutes or so on that. So maybe I can start with Rodolfo. There was a question about sharing a bit more on the causes of very few examples on horizontal expansion globally. And then to link this with another question that was looking at some of the global studies, if you can give a bit of an explanation of what are some of the differences in the recommendations from the shock responsive social protection work that you did in Latin America. So over to you, Rodolfo.
Okay, thank you, Ellen. Okay, let's start with the question about horizontal expansion, and let me base my answer on research that we conducted with DFAT, and the paper was published a few weeks ago at global level, collecting evidence from different countries, from different regions, and in relation to if you want to expand horizontally, then you could either use existing data or collect data after the shock, no? And collecting data after the shock, I mean, there are a number of experiences, but that requires a lot of preparedness and having the right instruments for collecting data and so on. Using existing data, there are two options basically. So one is collecting data ex ante precisely for horizontal expansion, and this is the case that is usually shared in the literature is the example of the HSMP in Kenya, in which they collected data and they pre-register households before there is a shock and to be ready to scale up. But we haven't found other examples like this, and this is probably because of the fact that it's a very expensive measure, and it's also it requires a lot of ex ante commitment. Then the other option is to use existing data, the data that social registries, for example, have. They have a lot of data on demographics, socioeconomic, and so on, to use that data to respond, no? And we haven't found many cases either. And the reasons are, first, because I mean the coverage and the quality of the data in social registries is still limited in many countries. That data is not always relevant. It is, as I mentioned before, it's collected for different purposes, so it doesn't allow measuring vulnerability and risk exposure. It's not up to date. No, it could be 3, 4, 5 years old. It is rare for governments to have protocols that allow them using this data and sharing this data. So sometimes even if the quality is good enough, there are no protocols or mandates in order to share that data with DRM or whoever is responding in order to use it to inform a response. Then there is in some cases there is a lack of operationally relevant data for informing a response. And then when you respond using data that was collected before the shock, it's likely that there are going to be significant errors of inclusion and exclusion. And this is of course a policy concern, in particular for those with a more kind of social protection mindset, no? While for humanitarians, the priority is of course to provide support as fast as possible. So these are some of the explanations why we've seen few experiences. And then as I mentioned before, of course that expanding horizontally requires a lot of investment and commitment, and well, in the end this is a nascent policy area, and in many countries we are still not there yet. In relation to the differences with Latin America, I mean, these two regions are sometimes considered comparable for a number of reasons, and there are some points in common. The fact that in both regions overall, DRM and social protection haven't interacted a lot, with some exceptions and so on, but there are also some key differences, no? And that are reflected on the recommendations. One is in relation to information systems. In Latin America, and I mean, not in every country, of course, but many countries have quite developed social registries and methodologies for collecting data and so on. And this creates an opportunity for responding horizontally, piggybacking, and some other ways. That is not the case in most ASEAN countries yet. The same in terms of coverage. In Latin America, in many countries, the flagship cash transfer program and the school meals program tend to have substantial coverage, and that brings opportunities again for piggybacking and vertical expansions. Then, although there is a lot of work to be done in Latin America in terms of financing, there are some interesting experiences, like for example the Caribbean Catastrophe Risk Insurance Facility, CRIF, which is a regional body that provides insurance to countries against certain shocks, and therefore there are some experiences along these lines that provide opportunities and therefore different recommendations. So overall, I think in ASEAN there are some similarities with Latin America, but given the stage of the social assistance system, I think it's even more important to keep investing in strengthening the social assistance system and focus on key aspects of delivery mechanisms. Over to Ellen.
Okay, thank you, Rodolfo, for that very thorough response to those questions. Another question that we have that's come in is, given the high level of disaster risk in the region, one would expect countries to have relatively well-developed disaster response mechanisms compared with other regions. Have you found other examples of where the use of a social protection program solves a problem more effectively than simply using or improving the existing DRM mechanisms? And this is from the example that was given in Cambodia on a slow onset drought, and in other countries. Is it more that you could use social protection for shock response, but it's not always clear that you should? So Hang, can you lead us with a response to that? And then can we go to Maham?
Okay. Well, very quickly, I think the period of 2005-2015, when the global community has been implementing the Hyogo framework for actions, has seen the significant improvement in the general disaster risk management, as well as in the response system in the ASEAN member states. So we have like better recognitions of disasters, better coordination system in place to coordinate disaster response informations when disaster happened, but it's not yet like a move towards ex-ante allocation of resources for disaster preparedness and response. It's still like respond when something happened. But I think in addition to the example, in other countries, you see emerging example of the use of social protection for disaster response and recovery, rather than just using the conventional system. If you look around, like the 2018, for example, series of disasters hitting the ASEAN countries, you can see not only last year, but also in the previous year, you can see increasing cash for work in disaster recovery in Myanmar. Increasing use of the mother and child cash transfer in Indonesia, in Laos, for cash transfer to the flood and the tsunami and earthquake affected victims. You can see also, like Indonesia, the use of the existing government cash transfer for children of the poor family to have ensured the access to nutritious foods. So the potential for the countries to use social protections for more effective disaster response and also moving forward resilient building, like it's a very strong request in Vietnam. I think it's there for the regions. I hope I answered the questions.
Yes, okay, thank you. And Maham, do you have anything that you'd like to add to that?
Yes, so I think it is important to understand that DRM is not, the social protection is not a replacement for DRM. So any investments In DRM, standalone investments and standalone investments in social protection are still needed. So what we are not trying to say is that you should stop investing in disaster risk management, both in terms of preparation and then response, and replace it with social protection. That is not, I think, the message. The message is that we need to see if we can use social protection systems to support disaster preparedness and response. And so whether that's in terms of building resilience, as Hang was mentioning, or whether it's in terms of disaster response, as Rodolfo was mentioning in some examples earlier, they're complements to each other, but they're not replacing each other. So I think that's something important to note.
Thank you, Maham. If we can go on to another question. There was one question about shock responsive social protection. Would it be able to work for localized shocks, such as in a village devastated by a landslide? So Maham, you're shaking your head, so let me send that question your way.
That's a very good question, because that's precisely, for example, in Laos, we found that it was also very localized flooding, flash flooding through rains. That was a huge issue and was the kind of disaster that local authorities could not get funding from the center. And that is the case in a lot of countries. And that is certainly a potential area where existing social protection programs, so for example, if there's a cash for work program, or if there is a cash transfer program, it can be used to respond quickly. I think one of the challenges in these types of very local disasters, whether they are quick onset or whether they are slow onset like droughts, is that in the region more generally, the disaster risk systems are not designed to forecast risk at a very local level. And so that is, again, an area of investment for the future, where a lot of countries, they get weather forecasts and weather updates, but the more detailed risk modeling is not available, or risk forecasting is not available. So again, I think that is an area where we need to invest, but definitely there's room for social protection programs to respond in that instance.
Thank you, Maham. I'm looking a bit in the time, and we have one more question. So if it's okay that we go to this last question, based on the studies and experiences, what is the appetite for pre-positioned data in the region? Rodolfo, can you take a stab at that one?
Yes. Maybe then Hang can also help me answering this question based on the work in different countries. I think it would require a substantial investment, given the stage at which these social registries and beneficiary registries are in many countries, not in every, but in many countries. I think that there isn't a lot of appetite in some countries at this stage. No? And we are talking here about what I mentioned before, for example, the case of the HSMP in Kenya, in which they collected data precisely for expanding horizontally after a shock. No, there is a lot of appetite for investing in social protection information systems, and that's why there is a lot of ongoing work. And I think there is appetite also for, and this was reflected in discussions about the ASEAN guidelines, about making these systems more risk informed and capturing information that allows measuring vulnerability and exposure to shocks. But it's different to say that countries are thinking about, or there is an appetite to collect substantial amounts of data to pre-position and be able to scale up. No, that's my take.
Okay, thank you, Rodolfo. Hang, did you want to add anything to that?
Yeah, I mean, I would agree with Rodolfo. If you look at, I mean, for example, the example of ID Poor in Cambodia, for the kind of poverty and vulnerability data to get information ready for the government, but as well as other actors. And I think that applies to many social protection systems in other countries. At the same time, if you look at the disaster risks and vulnerability data information, with a number of countries increasing the hazard mapping, vulnerability and risk assessment, including getting down to even district level, like in the case of Indonesia, or in the case of Vietnam, with targeting the 6,000 most vulnerable communes for risk assessment and getting data information ready for disaster preparedness and response. So I think the awareness is there, the kind of like recognitions of importance of data information is there, and the efforts are in place, but it just like perhaps could take place faster.
Okay, great. Thank you very much, Hang, for that response. We're getting close to the end of the webinar, so if I can take this time to have each of the panelists give maybe a 2-minute overview or closing, if you have any additional remarks you'd like to make. If we can go in the order that you presented, so start with Maham and then Rodolfo and then Hang. So over to you, Maham.
Sure. Thanks, Ellen. I think in conclusion, based on the work that we've done here in ASEAN and also elsewhere, that Rodolfo and colleagues have done, this research from our perspective aims to document existing experiences of shock responsive social protection, but also provide a platform for policymakers to decide and think about whether this is something that they are ready to do. And what I would like to again emphasize is that within ASEAN, different countries are at very different stages of development. So we have some countries such as Myanmar, for example, where information systems and implementation systems are fairly preliminary, and coverage of social protection systems is very low, for example, Laos. And then you have countries such as Thailand and Singapore, which are high income countries to medium high income countries, with very well established social protection systems, well established data systems as well. So again, we should not look at ASEAN as a uniform region and recognize that countries are at a very different stage of development. Rodolfo?
Okay, thank you. So basically to reinforce the fact that all this work and assessment of the opportunities for shock responsive social protection need to be complemented with a careful assessment of the effectiveness of the DRM sector in every country. That there was a question about, in the end, what's the value added of social protection, and that, of course, needs to be answered in a context in which we have a deep understanding of DRM, and in some countries there may be a need for social protection to contribute to a response. In others, it may not. So we need to be open about that. The other thing is that I mean, we talk a lot about the fact that the social assistance sector is still developing, and that there aren't many opportunities, that we haven't seen many experiences in using this system to respond. I think it's important also to think about the social security sector in the region. We found, again, very few experiences, but given how strong this sector is, despite the coverage limitations, I think it's important also to take into account this sector and not just focus on social assistance, particularly in a region like ASEAN. No, that's all. Over to Hang.
Thank you, Rodolfo. I think my point was very close to yours, because during the process, there was kind of a recommendation that since even the social assistance systems in the region are still developing, why don't we focus on advocating on a general improvement of that systems rather than introducing like the new concept of shock responsiveness, is it too premature or not for the ASEAN? The way that I see it, and I have learned from the process, is that actually this kind of like new way of looking and then the emerging experience in the region actually created opportunity for both the social protections and the disaster risk management to look back at what kind of like progress with reform that they have been doing and what else that can be done differently. We may not be able to come up with immediately like shock responsive social protection programs in a year or two, but at least we have created that kind of like interest, political interest, and the commitment to look into the new ways of doing business. So this is the biggest value that I see from the process. Thank you.
Okay, great. Thank you. And I would like to thank Hang, Rodolfo, and Maham for your presentations today, as well as this very interesting discussion on the different areas of the research that you've conducted for the shock responsive social protection in ASEAN, especially looking at the diversity of the region and how the social protection systems have working with the different data management systems and platforms that you have, and linking these together with the disaster risk management. And as well, the interesting process that we've gone through for the roadmap development and how this will be then linked with the ASEAN specific guideline development, and the next step in this work to see rolling out these guidelines that have been developed with ASEAN and in the specific context of the different countries under the ASEAN member states. I'd also like to thank all of the partners who have been involved in the process, especially the ASEAN member states and the different working groups, and their participation in the stakeholder discussions. And especially thank you to ECHO for the funding of this study and this project, and the other partners that have been involved in making this whole project a success. In closing, we just want to remind you that you can view the presentations on this webinar on the socialprotection.org website, and that, as you see on the screen, to become a member of socialprotection.org and receive the information of other webinars that will be available coming up on the different topics around social protection. So with that, I'd like to thank you all for participating in the webinar, and we look forward to continue working together on this topic as we're moving forward in the ASEAN region.
Thank you. Bye.
Thank you. Bye-bye.